Good afternoon, everyone, and a big virtual welcome to IISS. This is the first webinar in our IISS student program, and it's available exclusively to students. The IISS student program is aimed at getting the Institute more engaged with students and to inspire young people interested in global security, political risk, and military conflict. So as part of this program, we've appointed 6 student ambassadors who help us stay connected with students in London. And in this event today, we aim to give students first-hand access to the research and the expertise of our many IISS analysts, and as well to give students the opportunity to ask questions about our webinar topic today. Today, we're asking what the regional and global implications are of the COVID-19 pandemic. More specifically, how is it going to impact countries in the Middle East and the Gulf, in South Asia and in Africa? I've got 3 excellent panelists to try and answer these questions. First of all, we have Nick Crawford, who is Research Associate for Geoeconomics and Strategy at the IISS. His research focuses on great power competition in developing countries, including coercive economic diplomacy. And his recent work has focused on China's economic and political activities in Africa and in Eastern Europe. We have Camille, who is a research associate based in the IISS Middle East office in Bahrain. She covers political and security developments in the Gulf region with a specific focus on Gulf countries' economic and political relations with Asian powers and with the Horn of Africa. And we have Viraj Solanki, who is a research associate in the South Asia program, where he carries out policy relevant research assignments, coordinates speaker and workshop engagements, as well as supporting the program in implementing ongoing projects on South Asia. I will begin first of all with Nick Crawford. Nick, the floor is yours.
Thank you very much, Nella. And thank you to Celia for organising the event, and thank you to all of you for joining. So I'm going to focus my remarks on the economic and political impact of the COVID-19 pandemic in Sub-Saharan Africa. At this stage, I think it's quite difficult to judge health impact in the region. Data is too limited. It's also very early in the course of the pandemic, and also I'm no health expert. So first of all, the immediate economic impact of the pandemic. Obviously, the pandemic is affecting all regions. I think it's worth just highlighting some of the vectors of that impact in Sub-Saharan Africa. Well, firstly, lockdowns elsewhere in the world have of course hit African exports, particularly of commodities, of oil, of inputs to manufacturing, and of course has affected the tourism and transport sector severely. Lockdowns within Sub-Saharan Africa have obviously affected domestic economic activity. Additionally, and this is less important for some other regions, but African citizens working elsewhere in the world often send large amounts of money back to Africa in the form of remittances. And that forms quite a large part of African countries' GDP. The World Bank estimates that remittances are going to fall 23% as a result of the pandemic. And in addition to that, over the past 10 or so years, Sub-Saharan Africa has witnessed unprecedented inflows of capital, portfolio capital. So that's investments in debt and equity. And the pandemic has affected investor confidence, and that capital has taken flight and left Sub-Saharan Africa. So in South Africa, for example, in March and April alone, that capital flight amounted to 1% of GDP. On top of that, we've had collapsing oil prices, of course, and although the severity of it is not yet clear, there's the locust swarm in East Africa, which could cause damage to agricultural output in Kenya, Ethiopia, and Uganda especially, and potentially more widely. So a couple of additional factors on top of the pandemic. So how will this play out? Well, there's the makings of quite a serious debt crisis in Sub-Saharan Africa. Not in every country, there are 49 countries in Sub-Saharan Africa, but in a surprisingly large number of them. So before the crisis, debt had risen quite significantly since the mid-2000s. African countries have needed to borrow heavily in order to bridge their infrastructure gap, to build energy and transport related infrastructure over the past couple of decades. And that lending has come primarily from China and from the private sector. But on top of those already quite high levels of debt, now government expenditure is up, spending on the public health response and spending to cushion the economic impact. At the same time, government revenues are of course down, both tax revenues and non-tax revenues from oil and commodities. So governments in Sub-Saharan Africa are going to be running much larger budget deficits over the coming year. And this comes at a time when debt servicing costs are going up, so the cost of paying debt obligations that already exist, and they've gone up because of currency fluctuations, but also borrowing costs are up. So where they're running budget deficits, those budget deficits are going to increase, their debts will increase even further because the cost of lending has increased. So already, Angola and Zambia have begun to renegotiate their debts. That's on top of 7 other countries that were already in a state of debt distress before January. And there's a prospect of many more countries in Sub-Saharan Africa struggling along the same lines, South Africa, potentially Ghana, and several others. It doesn't affect all countries in Sub-Saharan Africa. Some are in a much better position, such as Tanzania and Cote d'Ivoire. What are the prospects for sort of containing this debt crisis? Well, for African governments, they don't have access to the same policy tools that governments in Western and other rich countries do. Because African governments borrow from external lenders, they can't easily inflate their way out of a crisis, and that's risky anyway. And although their debt levels are low compared to the US, UK, Japan, Italy, the cost of servicing that debt is much higher, and they have much less scope to raise taxes or to cut expenditure. Having said that, cuts to expenditure are quite likely, and cuts to public services as a result. So Nigeria, for example, has already announced 15% cuts to government spending. The IMF has acted quickly. It's lent at an unprecedented scale to Sub-Saharan Africa over the last 4 months. But given the need for US dollars, hard currency, within Sub-Saharan Africa to service debt obligations and to pay for imports, that need for US dollars may well exceed IMF's lending capacity. So Sub-Saharan African countries are likely to need additional liquidity. And where might that come from? Well, this will partly depend on the United States. So one potential source of temporary US dollars is for the US Federal Reserve to introduce currency swaps with central banks in Sub-Saharan Africa, the South African Central Bank, for example. That provides some temporary relief by allowing those central banks to exchange their local currency for US dollars. Another option, and a slightly longer term option, is for the IMF to issue what are called special drawing rights. So that's a package of US dollars, Chinese yuan, Japanese yen, euros, and pounds. So that's producing additional money as such, and then distributing it to Sub-Saharan African countries and other developing countries. But the current US administration is currently unlikely to support either such measure. So liquidity support is one aspect. The second aspect of trying to curb this crisis is debt relief. China is now the largest creditor of Sub-Saharan African countries, so much will depend on them and how they negotiate debt relief. The problem is that China's approach to debt relief is to not cooperate with other creditors and to renegotiate in quite an opaque way. This means that the process of renegotiating debts is likely to last a lot longer, and that debt relief may not come in timely fashion. There are also problems with debt relief from the United States because the government needs to make appropriations through Congress, and Congress again looks unlikely to make those appropriations with its current makeup. So a lot will ride on the US presidential election in November and also on China. But looking beyond the debt crisis, what are the economic prospects for Africa more generally? Well, this is different from the last economic crisis. Africa is in a different place in terms of debt as I've already mentioned, but also so are other parts of the world. In the last economic crisis, rapid growth in China, and therefore rapid growth of exports to China, allowed Africa to continue growing through 2008, 2009, 2010. So we're likely to see slower growth in exports, but also due to that lack of fiscal space, lower investment going forward. So looking ahead, you'll see slower growth, a widening infrastructure gap, which means slower progress on access to electricity, digital connectivity, road connectivity, and so on. And of course, slower growth in a continent with a growing youthful population means more unemployment. And with that, political risks are increased, greater migration pressures, and of course, greater political pressures domestically. Because of that lack of fiscal space and the difficulty with borrowing anymore, African governments are also likely to borrow less from China in the next few years. Angola, for example, one of the countries most affected by the debt crisis, was by far the largest recipient of Chinese loans within the region. That doesn't mean that China-Africa cooperation on infrastructure projects will stop, but they'll be looking to alternative models of cooperation going forward, such as concession agreements and public-private partnerships. Let me end on a more optimistic note, and that's regarding regional cooperation. The pandemic has highlighted Sub-Saharan Africa's dependence on other regions of the world for essential goods, fertilizer for agriculture, personal protective equipment for hospitals, medicines to treat the disease. It's also shown, though, that some of this can be developed and produced in Africa. For one example of this is the rapid test for COVID-19 developed in Senegal in cooperation with the UK. And the pandemic has fueled growing recognition in Sub-Saharan Africa of the need to develop regional production of essential goods. And that feeds into this a wider trend towards boosting regional trade. Already in 2018, 44 states signed up to the Africa Regional Free Trade Initiative, which is intended to eliminate tariffs on inter-regional trade and hopefully further down the line, non-tariff barriers. That was supposed to be launched this year, but COVID has delayed the launch. But I think it re-emphasizes the importance of this initiative. Increasing regional trade will diversify African economies in terms of sectors, with more manufacturing and more value-added activity on top of agriculture, for example, and also diversify the region's export partners, making them slightly less reliant for their growth on other regions of the world. Now, that isn't an answer to pandemics, which disrupt African economies domestically, but it would begin to reduce Africa's vulnerability to other types of external economic shock. I'll leave it there.
Thank you very much, Nick. Before I pass over to Camille, I should say that please do keep your questions coming using the Q&A feature. I see we already have one there that we'll answer along with any others that you submit once our panelists have finished speaking. And with that, Camille, I'll hand over to you.
Thank you very much, Nila. So I've been asked to speak about the COVID pandemic and its ramifications in the Middle East and North Africa. As Nela mentioned, I am based in Bahrain and my research area is mostly the Gulf states, but I try to give you a general picture of what's been going on in the region. But this is going to be quite difficult because what is really the striking feature of this crisis in the Middle East is the diversity of reactions from different states and of situations. And it's very different when you talk about how Saudi Arabia has been reacting to the crisis, and when you compare it to Tunisia or countries like Syria or Libya. So I'll try to give you a general idea. I'll start with just giving you an idea of how states have been responding. And secondly, I speak about the economic ramifications of this. And lastly, I'll try to give some ideas of how this could impact the politics of the region. So just to give you a quick initial understanding, so Iran is probably the first country that has been hit by the crisis, and it's been it has become a hotspot in the region very quickly. This was due partly as well because of the US sanctions and to different factors, but Iran has become a hotspot. Turkey has become a second one. Then the crisis has expanded to Gulf countries quite quickly through Iran mainly. And then the crisis has expanded, the pandemic has expanded to the rest of the region. And today there are some initial signs of rebound, possibly in Iran. It's too early to really assess it, especially because it's difficult to have access to that data. But we see that for the moment, the countries that have been mostly touched by in terms of number of cases are Iran, Turkey, then the Gulf countries, and the rest, like North Africa, have been much less hit. So in terms of the state capacities and the way states have been responding to the crisis, as I said, we have a huge diversity in responses. And this is linked to a huge diversity of economic and political situations across the region. In the Gulf, for example, you see that they have been able to implement severe lockdown measures quite early on, especially in the UAE. They had the capacity to deploy testing kits and masks across their countries quite rapidly. They have also implemented huge fines for anyone who would breach the lockdown or anyone who would spread false information. So they had some state coercion capacities that a lot of the rest of the Middle East don't have. And if you compare it to other countries who have been through important economic difficulties like Lebanon, or political instability, or even failed or weak states like Yemen, Syria, Libya, here there is very, very little capacity to coordinate the response. You even see some non-state actors jumping to fill the gap of the states. You see that Hezbollah has played quite an important role in certain parts of Lebanon, the Popular Mobilization Forces in Iraq. And so this gives a very different picture of how different states have been organizing the response to the crisis. There is also a difference in terms of how the states have been communicating to their population about the pandemic. So you see that in Iran, for example, they have been very reluctant to give the numbers and to speak about the pandemic, and they've denied it for quite a long time, partly also because there were some parliamentary elections that were happening in February. And so because of that, some analysts consider that this has not helped also the spread of this has helped the spread of the virus and has not helped the effectiveness of the state. And on the contrary, you have some countries like Jordan who have less state capacity, but have been much more transparent in the way they've been dealing with the pandemic. So moving on to economic consequences, again, huge diversity depending on the initial context of the countries. In the Gulf, for example, they have already had some important financial buffers that help them support their economies. They have implemented huge stimulus packages to support employment rates, to support the SMEs, etc. So this is quite different from states like Lebanon, Egypt, that are already facing important debt crisis, and the pandemic is likely to reinforce these economic difficulties. In conflict zones, you have also the issue of refugees and how to deal with refugees and IDPs. They are also heavily dependent on international donors. So you have the whole question around to what extent this economic support from the outside is going to be maintained to the same levels. Syria, for example, is also very dependent on Lebanon. Lebanon is used a bit as a corridor for the goods and the financial support that is going to Syria. And with the Lebanese crisis at the moment and reinforced by the COVID, there are huge questions about how Syria is going to deal with its own difficulties in times of crisis. You also have the question of states that are under sanctions. And that's the case of Syria with the Caesar Act. US sanctions are going to be reinstated today. Again, big questions on how this is going to impact the economy and compound with the current crisis that is triggered by the COVID. Same thing in Iran. Part of the reason why Iran was one of the hotspots of the region is also because Iran was under US sanctions that have not helped strengthening the resilience of the state. So we have a very different, very different picture depending on states and on their economic situation. But this could give the impression, for example, that Gulf countries can be shielded somehow from economic difficulties. But another thing that you have to take into account is also how integrated these countries are in the global economy and how they're dependent on global supply chains. And the fact that the pandemic has also disturbed a lot these global supply chains is, for example, a major source of vulnerability for Gulf countries. For example, they rely hugely on oil exports for their own economy. It represents 65% about of their state revenues in Saudi Arabia. So, with the crisis, this is becoming a huge vulnerability for Gulf states. Same thing, they're heavily reliant on food imports. It's 80%. They import 80% of their food. So with the disruption of global supply chains, it can be a major vulnerability. Another vulnerability also, but I don't have much time, but it's about remittances, as Nick talked about. We have the same issue for a lot of countries in the region, for example, that have Morocco, Tunisia, Egypt. They have a lot of workers in the Gulf, and we have now a lot of uncertainty about the future of these workers, and this is going to have an impact also on economies like Egypt, especially. So jumping in quickly on the long-term political consequences, it's still very early to make any assessment, but just to give some initial ideas of what could be the consequences. We have first, so the countries in conflict, as I said, Libya, Syria, Yemen, and the whole question of how they're going to continue attracting some foreign support for their post-war stabilization, reconstruction processes. There are some reports stating that Daesh is using also a little bit the opportunity of the crisis to increase its number of attacks in Syria and Iraq. So in a lot of these fragile countries, there are some chances that the crisis is going to increase this instability. Same in countries like Lebanon, where we have a lot of protests going on at the moment. Even same in Gulf countries, where there is a risk that this social contract between the state and the population that relies a lot on the rentier economy, there is a risk also that this is going to be put under pressure. Then other elements interesting to watch is also on a more global scale, as we see during the crisis, the rise of the US-China rivalry, and how this is going also to affect a lot of the countries in the Middle East. We saw it not long ago in Israel, but it could be also an important factor for the future in the Gulf. So I'll stop here. Thank you.
Thanks very much, Camille. I see we've got quite a lot of questions piling up, so I'm going to quickly pass over to Viraj, and then we will begin questions. Thanks, Viraj.
Thanks, Nella. I will speak today on COVID-19 in South Asia, but with a particular focus on the pandemic's impact in India and Pakistan. The COVID-19 pandemic has severely disrupted economies, challenged governance, and tested public health infrastructure in South Asia. And with densely populated urban areas, weak public health systems, and among the lowest COVID-19 testing rates in the world, there are concerns over the region's ability to effectively limit the number of infections and deaths. COVID-19 cases are rapidly rising across South Asia. As of today, the 17th of June, South Asia has over 640,000 cases of COVID-19 and close to 17,000 deaths. And of this, India accounts for 55% of all cases in South Asia, with 350,000 cases and nearly 12,000 deaths. Pakistan has 154,000 cases and nearly 3,000 deaths. And Bangladesh has over 94,000 cases and over 1,200 deaths, and with a spread of the virus in the country's Rohingya refugee camps. Firstly, on India, with its citizens comprising 1/6 of the world's total population, its ability to effectively limit the impact of the COVID-19 outbreak within its borders will have both regional and global implications. India's first coronavirus case was reported on the 30th of January in the southern state of Kerala. And then to limit the spread of the virus, on 24th March, India's Prime Minister Narendra Modi ordered the world's largest lockdown of 1.3 billion people with 4 hours notice only. And this 75-day lockdown was gradually eased from the 8th of June. Yet in early June, India has overtaken the UK as a country with the 4th largest number of COVID-19 positive cases. And with a peak expected only weeks later, India is likely to be one of the top 3 countries of COVID-19 cases and deaths, along with the US and Brazil. Within India, each of its 36 states and union territories face their own challenge in dealing with the virus. In particular, 4 states, the capital Delhi, Maharashtra, which is home to the financial capital Mumbai, Gujarat and Tamil Nadu, account for 2/3 of all of the confirmed cases in India and nearly 80% of all of the total deaths. Delhi's Deputy Chief Minister, who has actually just tested positive for COVID, has said that the cases in the capital city alone could increase rapidly from the current 44,000 to 550,000 cases by the 31st of July, whilst Mumbai has now overtaken Wuhan for the number of COVID-19 cases that it has. The Indian economy has been badly hit. The World Bank expects India's economy to contract by 3.2% in financial year 2020-2021, with a likely possibility of its first annual recession since 1980. In financial year 2019-20, India's economy had grown by only 4.2%, which was its slowest pace in 11 years. And reportedly, over 120 million people have become unemployed as a result of the pandemic. Enforcement of the lockdown has been particularly difficult for the millions of migrant workers working in India's big cities. The economy is heavily labor dependent, with the construction industry being among the biggest employers of India's 40 million migrant workers, and approximately 90% of India's 470 million workers are employed in the informal economy with no formal contracts and subsisting on daily wage payments. It led to considerable hardships for some 10 million migrant workers traveling across the country to return to their homes, with transport services and state borders shut. In urban India, reportedly about 139 million Indians will run out of their savings by the end of June. Concerns also remain of the ability of the country's weak public health system to cope with a widespread outbreak of COVID-19, with hospital capacities across the country being stretched. India spends only 1.28% of its US $2.94 trillion gross domestic product on healthcare, which is among the lowest spending in the world. And delivery of public health care in India is managed at the state level and then supported by the central government. Now on to Pakistan, where there are about 5,000 new COVID-19 cases daily, and cases are expected to peak in late July, early August. A Pakistani cabinet minister has predicted that the country will have 1.2 million cases by the end of July. And although Pakistan's Prime Minister Imran Khan was reluctant to enforce a countrywide lockdown, citing concerns over the impact on the economy, this did take place for 6 weeks only, from 26 March until the 9th of May. However, because of the increasing rise in cases since the lockdown has been eased, another lockdown has been enforced from yesterday in coronavirus hotspots across 20 different cities in the country. The army has also been deployed to enforce lockdown measures, and the country's powerful Inter-Services Intelligence Directorate has deployed surveillance technology, which is normally used to locate militants as part of the country's track and trace system for COVID-19 patients. In terms of Pakistan's economy, for the first time since 1952, Pakistan's economy contracted in financial year 2019-20 with a contraction of 0.38%. The World Bank expects Pakistan's economy to contract again in financial year 2020-21 by 0.2%, and up to 18 million of the country's 74 million jobs could be lost. Thirdly, in terms of regional cooperation, the pandemic has actually generated for the first time in 6 years a summit, although a virtual summit, on 15th March of the main regional forum, which is the 8-member South Asian Association for Regional Cooperation, or SARC. Amidst India-Pakistan sparring over Kashmir, a voluntary COVID-19 emergency fund for SARC countries was set up, amounting to $21.6 million. And apart from follow-up meetings of trade, health, and commerce officials, little else has been achieved as a result of this meeting. India separately has provided crisis assistance to regional countries, including medical supplies to over 150 countries and pharmaceutical supplies to over 85 countries. It's also deployed medical assistance teams to Mauritius, Comoros, Maldives, and Kuwait, and has also sent naval ships to 5 countries in the Western Indian Ocean region. In the wider Indo-Pacific, India now has 2 separate so-called Quad Plus dialogues on COVID with the other 3 members of the Quadrilateral Security Group, the United States, Japan, and Australia, and also with South Korea. India has participated in a foreign ministerial meeting with these countries, along with Israel and Brazil, and a foreign secretary, US Deputy Secretary of State level meeting with these countries, along with Vietnam and New Zealand, in order to discuss the sharing of best practices and helping global supply chains work better. Financial assistance is also being provided to South Asian countries by various multilateral institutions and bilateral donors, including the World Bank, the US, China, Japan, and the United Kingdom. Finally, with lockdowns eased in South Asia, cases are rising rapidly across the region, particularly in India and Pakistan. Therefore, it will be important to watch the region's ability to manage the spread of COVID-19, along with the health policy and economic challenges caused by the pandemic in the coming weeks and months as cases reach their peak in South Asia. Thank you, and I look forward to answering any questions.
Thanks very much, everybody. Okay, we have large numbers of questions coming in, so I'm going to group together questions directed at each particular speaker and then later throw out questions that are more general to all 3 of you. Nick, let's start with you. Katerina Fletcher has asked, why is the cost of debt going up despite banks globally lowering interest rates to cope with COVID? And I'm going to throw in one more question for you right now, if I may. From Sam Van Shake, he says, hi Nick, do you think that China has lost some legitimacy in Africa in its role as, quotation marks, its ATM? And this is in light of China's conduct in the last year of claiming ports and also the poor quality of its infrastructure projects. Can you begin with those, and then I'll turn to the others?
Sure. I'll give a very quick response to Katerina's question because I've also just typed a response. But roughly, borrowing costs are going up for African governments because of 2 things: 1, perception of risk, and 2, the makeup of their creditors. African governments are perceived as riskier debtors, with a slightly lower chance of them repaying their debts, which is reasonable given the increasing chances of debt distress. And they borrow, especially from external sources, bond investors, commercial banks, and they are unwilling to lend at the moment to risky countries, perceived risky countries in Africa, unless the interest rates are higher. So rates on bonds will go up. In response to the second question, perceptions of China's legitimacy in Africa, and in particular whether port seizures and things like that have had an impact on perceptions of China in Africa. Well, firstly, on the issue of port seizures and the notion of China's lending as a debt trap, the picture is a lot more nuanced than is sometimes presented. China has not widely seized assets, particularly infrastructure assets, in return for debts. One frequently cited case in Sri Lanka is more complicated than it first seems. The Sri Lankan government actually offered the port a lease on the port themselves in order to try and pay off the debts. It wasn't a China-driven initiative, but regardless, that is really the main example. It's not widespread. China, while being reluctant and slow to offer debt relief and doing so on quite tough conditions, does offer debt relief. And after all, it's in China's interest to do so because it has investments in Sub-Saharan Africa, and Chinese companies are working on those infrastructure projects. If Sub-Saharan African countries go into default, have to cancel projects, and their economies go downhill, this is not going to work well for Chinese companies working in Sub-Saharan Africa. Perceptions of China's legitimacy in Africa are a slightly different matter. And there's probably a difference between perceptions within government and perceptions in the general public, within the media. I think there's certainly plenty of criticism of China within Africa. But the reality is that for African governments, where they do want to borrow for infrastructure projects, they don't have a huge number of options available to them. The lending available from multilateral development banks doesn't match the scale of their ambitions for capital projects like ports and roads and railways and electricity generation. And so they will continue to look to China for those projects, I think, where they have a fiscal space to do so.
Thanks very much, Nick. Camille, I'm going to pass over to you now. So we have a question from an anonymous joiner asking, did the sanctions imposed on Qatar help it become more self-sufficient and somewhat resilient from the supply chain crisis that came about because of COVID-19? And Usaid Morabi asks, what do you think of countries like Libya and how the impacts of COVID will affect them both debt-wise and in its domestic economy?
Thank you. So for the question on Qatar, yes, there are some reports about the fact that Qatar has become more self-sufficient and more resilient since the crisis with its neighbors. The thing is that, yes, it is possible that it has had a kind of training with this crisis on how to mobilize state capacities to build up resilience to a major supply chain crisis. But Qatar remains very heavily reliant on imports and exports anyways for its economy. That's due to the size of the country. This is not going to change anytime soon, to the size of the population as well. And when you look at just the number of cases, Qatar is the hotspot of in terms of a number of cases. When you report it to the number of to the population, it's really going under a lot of pressure. So I don't know. It would be an interesting case to watch and to see in the future if it's more resilient than other countries. But I would nuance this statement because it's still very dependent on imports and exports. It has also a financial cushion. It had a better financial cushion than its neighbors. So this is also a positive thing for Qatar. But I'm not sure this is really necessarily linked to the GCC crisis. On Libya, the problem is that I'm not an expert on Libya, so I don't want to make a full statement here. So I won't be really able to give interesting insights. I would say one of the things to watch is the plummeting oil prices and how this is probably waiting on the economy of Libya as well. And one other factor to watch as well is external states' involvement, especially from the Gulf. For example, the UAE has been very involved in Libya. So we know that Gulf states in the past had have sometimes injected money to certain countries when they wanted to influence the political arena. So what would be interesting to see is if they're going to do so in Libya, if they will have the capacity to do so as well, because Gulf countries are going under pressures as well. So these are two elements of responses, but I wouldn't be able to give a full picture on Libya.
Thanks very much, Camille. Viraj, I'm going to turn to you now. We have Pan Siri Park asking whether India's states have taken a more or less disorganized approach in tackling coronavirus. Kerala stands out as an example of a state that has coped much better, or would you say there has been close interstate cooperation? And Emily Jones asks, how do you think COVID and the economic effects are going to change the power relationships with South Asia and Southeast Asia's One Belt, One Road members?
Thanks, Nella. I would take the second question first. I'll focus only on South Asia's relations in relation to the Belt and Road Initiative. It's been interesting to watch China's engagement with the so-called smaller countries of South Asia and the Indian Ocean during this pandemic, and its emphasis on increasing cooperation with these countries, especially on Belt and Road Initiative projects. So, for example, Chinese President Xi Jinping has spoken to the Nepalese president, to the Bangladeshi Prime Minister, and to the Sri Lankan president. And in each of these readouts, there has been a focus on the Belt and Road Initiative. The Maldivian ambassador has taken time during this pandemic to write 2 opinion pieces, articles in a local Maldivian paper, both stressing that during this pandemic, as both the China and the Maldives get used to this new normal, that they should increase a focus on Belt and Road Initiative projects. There's also been engagement from China in Mauritius, for example, which is one of the only island countries not to have signed up formally to the Belt and Road Initiative. Huawei, the Chinese technology company, has been providing COVID assistance to hospitals by providing video conferencing systems to hospitals in Mauritius. And so this is one way that China is trying to engage with Mauritius during this pandemic. And I think this will play a wider role of China's engagement in trying to incorporate Mauritius into the wider Belt and Road Initiative. So I think overall, during this pandemic, there's been a push from China towards the island and littoral nations of South Asia, and trying to engage with these countries and increase cooperation on projects, especially those in relation to the Belt and Road Initiative. And then on the first question on the state response, there's been, I'd say it's been a mix of states tackling this crisis on their own, but also interstate cooperation. There's because healthcare in India is managed at the state level, each state has had the opportunity to make their own decisions in relation to how it manages this overall pandemic. So as the question rightly said, Kerala has been touted as a so-called success story in the way it's handled this pandemic. But I think this decision, each state is facing its own decisions. And I think the severity of the cases within each state also impacts upon the decisions that have to be made. So, for example, you're seeing states that are continuing to impose lockdowns until the 30th of June, for example, despite the central government easing lockdowns from the 8th of June. So I think the ability of each of these states is really dependent on the size of the populations, the previous experience that these states have had, Kerala's had with cyclones and other disasters that have taken place, which have helped it prepare for such a crisis as now. So I think there are different elements to how each state has been able to prepare in combating this pandemic. But I think at the wider level, there's also been interstate cooperation, especially with meetings with the central government of all chief ministers, for example. So I think going forward now, there will be a real focus just really on how 4 of the main states combat this pandemic, and that's Maharashtra, Delhi, Gujarat, and Tamil Nadu.
Thanks very much, Viraj. Since most of our questions are targeted, I'm going to do one more round of questions directed to each of you before hopefully finishing on 1 or 2 that are directed to all of you. So I would ask you all to please keep your answers short and snappy for this next round. Nick, Isabella Kajiwara asks, can you comment more on the ongoing project in Senegal for developing rapid testing for COVID and the role of the UK and external actors in this? And Abigail Reynolds asks, how do you think COVID-19 is going to affect election outcomes and procedures in Sub-Saharan Africa? If elections are postponed, do you think that will contribute to the trend of democratic backsliding in the region?
Oh, tricky questions. And I might throw the second of those questions back at you, Nella. But on the first, on the Senegalese development of COVID tests, I don't know a huge amount about this. What I can say is it's a collaboration between a UK company and a Senegalese company called Mologic in the UK and Diatropics in Senegal. DFID, the Department for International Development, that will not be around for much longer, funded the development of the test on the basis that then the tests developed would be distributed in Africa on a cost basis. So UK funding has come in as a UK company, and it's been a collaboration there. I'd love to know of any other cases of this, so if anyone has come across them, do get in touch. I'd love to learn. On the second question on impact on elections, election timing, election outcomes, as I say, I'd quite like to throw this one back to Noah, but just a couple of quick thoughts. This year, Zambia and Ghana both face elections. Both of those countries are struggling with their debts. Those elections are competitive, so it wouldn't be hugely surprising to see changes of government, but I'm not an expert in either Zambia or Ghana, so I'm not going to try and predict any outcomes. One country that perhaps then, Nelly, you can comment on, where there's perhaps more of a concern around the democratic backsliding is Uganda. Uganda's public debts will have increased over 50% of GDP, to over 50% of GDP, and servicing those debts is taking up a huge amount of the government budget there, and they're having to borrow more at much higher costs. And that's in the country where there is already a degree of civil unrest and growing opposition to the Museveni government. If the situation deteriorated there, I can see it having more of the kind of impact on democratic backsliding that perhaps you allude to, but I defer to Nella on Uganda. She has spent a lot of time there.
I'm embarrassed to admit that I'm not particularly up to date with Uganda these days, but just to very quickly add on to what Nick has been saying, I think, and to refer back to the question, yes, there's certain, I think that COVID-19 is a cause for concern about democratic backsliding, not ubiquitously, but certainly among the regimes that were looking for excuses to delay elections. It's certainly an extremely convenient one. And as far as Uganda goes, I think we have seen a growing trend of a growing trend of harsher crackdowns on aspects that are perceived to be a threat to the Museveni regime. So I'm not hugely optimistic about how that's going to pan out, but in the interests of time, I'm going to excuse myself from commenting on that any further. Camille, Lucas Tenkov is asking, how long lasting do you see the effects of intergovernmental cooperation between Israel and the Middle East in relation to the common goal of containing the COVID-19 spread? And he's thinking here of the UAE airlifting supports to Tel Aviv. Further to that, how do you perceive the chance for COVID cooperation bridge building, given the highly controversial, highly criticized peace plan and annexing process supported by the Trump administration? And Josephine Olnoir asks, in Middle Eastern countries with a quote-unquote weak state, have international NGOs taken over the management of the pandemic, or are they only sending out equipment? Apologies, those are two big questions to squeeze into a short period of time, so but please do what you can.
So I'll sorry, did I mute myself? Yes. So just to go briefly for Israel and the UAE, yes, there is a lot happening recently during the COVID, a lot of interesting things. Youssef El-Taiba, also the UAE ambassador to Washington, doing a direct address and an op-ed about the US peace plan. Gargash, who is the UAE Minister of State for Foreign Affairs, talking about also cooperating with Israel to fight the COVID. So we see a lot of interesting signs of rapprochement, but this has been going on for a long time now, a long time before the COVID. The UAE doesn't have an official normalized relationship with Israel, but they have been cooperating on security issues, political issues. They have been, I mean, I could give you a list of things that where they have been playing an important mediator role between Israel and other partners in Sudan, for example, or others. So this is a trend that has been going on for a long time. There was a question on whether they're going to normalize their relationship with Israel or not. I think that this is still too early. But at the same time, they don't need to normalize relations with Israel to have political and security relationship with Israel. And so for the moment, I see things continuing as they've been going for the past 10 years on this. What was the other question? It was on, yeah, the response, the humanitarian response to the crisis. Of course, the different NGOs have been responding. I was discussing with a friend of mine who works for a big international NGO. But the problem is that the crisis has been hitting all the countries in the world at the same time. And so NGOs have been trying to adapt to the situation, but I couldn't say that they have replaced state capacities at all. And they've been crumbling under trying to assess the situation and respond as quickly as possible. But yeah. Yeah, that's all I could say.
Thanks very much, Camille. Let me pass now over to Viraj. Viraj, Samban Sheikh is asking whether Pakistan and India's efforts fighting COVID are higher in Kashmir than in the other parts of both countries. And Umar Ahmed is asking what you think the impact of COVID-19 will be on the China-Pakistan economic corridor.
Thanks. On the first question, quite the opposite, actually. During this pandemic, tensions between India and Pakistan on Kashmir have risen. Kashmir was raised, and Pakistan's objections to India's continued lockdown since its constitutional changes on the 5th of August 2019 in Kashmir, and how that was impacting medical supplies being delivered to Kashmir during the pandemic. So no, both sides have not focused more on the COVID response in Kashmir compared to the rest of each of their countries, and the COVID-19 the pandemic has actually just led has been not led, it's been a factor in the increased tensions between the two countries, which are only growing at the moment. And on the second question on the impact of COVID on the China-Pakistan Economic Corridor, actually the chairman of the China-Pakistan Economic Corridors Authority has actually said that the pace and the scope of work on these projects has actually increased during the pandemic. So it'll be interesting to see what are the actual tangible outcomes and actual developments that we can physically see that have taken place during this the last few weeks and months, but they are saying that they are working towards phase 2 of this project now.
Thanks very much, Viraj. Okay, in the 3 minutes that we've got left, and possibly in another 2 or 3 after that, if we're allowed, I'm going to throw 2 questions to all 3 of you. The first is from Eleanor Bennett. Can you please comment on the proliferation of misinformation and rumours related to infectious disease? For example, the rumour that the COVID-19 pandemic is a cover for a conspiracy to inject people with microchips. A speech made by an Italian MP called Camille went viral both through Africa and through Russia, showing that this is indeed an international issue. What would you say that this conveys about belief and trust in institutions, and what would the long-term ramifications be in the regions that you're covering? And the second question I'm going to throw out was actually targeted to Sub-Saharan Africa, but I think is very relevant to the other regions we're discussing as well. This is from an anonymous attendee asking, considering that there has been a huge debate on moving supply chains closer to home, how would developed countries developed countries moving their supply chains out of these developing regions that all 3 of you are covering, how will these affect the regional post-pandemic politics? All of you, please answer as fast as you can. Thank you.
I guess I'll continue the existing pattern and go first. On the authoritarianism, the conspiracy question about, I won't summarize this, lack of time. I find this one difficult to comment on, but all I'd say is I'm not sure this is a new phenomenon. Conspiracies are long-standing. There's often a tendency to believe new things. Of course, social media means conspiracies spread faster. But I'm not sure that necessarily the trust in institutions within Africa is less than it was previously. But on the second question on supply chains, I think this is a super interesting question. Will the desire to increase economic security mean that economic activity is moved out of Africa and the other regions we're talking about? Well, a lot of this attention is focused on China and vulnerability of supply chains to China and its political manipulation of that. I think it comes down partly to what the economic security response is, whether the response is to diversify the sources of certain imports, or whether the inclination is just to try and move as much back to your own country as possible. Now, the diversification maintains a degree of cost friendliness. It maintains relations with other countries, and frankly, it's probably a much more realistic option to diversify the sources of your goods rather than to try and manufacture everything. So that could actually work to Africa's benefit. The second thing is, you know, some of the things that are exported from Africa, particularly in the realm of commodities, metals, say cobalt from DRC, copper from Zambia, Namibia, uranium, etc. You know, these aren't things that can easily be sourced elsewhere in the world. And so actually they're further along the supply chains where those inputs to manufacturing are used, you might actually see more competition. And so more competition for things that Africa is exporting could actually work to its benefit. I think I'll leave it there.
Thanks very much, Camille.
I won't reply the second question because Nick did it quite well already, but just on the conspiracy theories, I think it was very interesting from the Middle Eastern point of view to see how the battle of narratives between the US and China have been playing out during the crisis. You have this Chinese channel, CGTN, that has created a YouTube channel in Arabic, all in Arabic, for Arabic watchers. And it was created during the pandemic, tackling topics specifically and narratives on the pandemic. And they have one of the videos, they're trying to spread a rumor about the fact that the pandemic could come from the US and not from China. So I think this is something quite interesting to watch and see also how this is being listened to in the Arab world, how it's been received, and you see in the op-eds as well in certain countries, especially in the Gulf, that a lot of Middle Eastern Gulf writers, editors are actually supporting a lot the Chinese view and the Chinese perspective on the crisis, and seem to be much less ready to support the US at all costs.
So, thank you very much. Viraj, your turn, and then I think we'll conclude.
Thanks. Very briefly on both. On the first question, it's been interesting in India to see the divergence of views on statements on China's handling of the pandemic at both the official and at the public level. Officially, aside from comments from one cabinet minister, there's only been, well, prior on the, just focused on the COVID pandemic, there's been very muted statements about how China has handled the pandemic. But at the public level, there's been a lot of anti-China sentiment and things like, such as the in the Indian public calling it the Chinese virus, the Wuhan virus. So that's been concerning. And then on the second question on supply chains, I think as my colleague Robert Ward, who's the director of the IISS Geoeconomics program, has previously said, I think now in terms of the supply chains and companies moving out of China, India has been touted as a country to which they would move to, but I think this seems unlikely for the near future, at least, and it's been evident in the way I think companies have actually been moving to places such as Vietnam rather than India at the moment. That's it. Thank you.
Thanks very much, everybody. And thank you, everybody, for joining us today. If I may take a moment to announce that we do have a student membership package available. This is priced at £85 a year, but it gives you access to over £1,000 worth of the publications that we produce throughout the year. That includes our journal Survival, our Adelphi books, the Strategic Survey and others, as well as priority access to events at Arundel House. Thank you very, very much for joining us today, and a huge thank you to our excellent panelists, and we hope to see you at future events. Thank you very much.